Welcome back. We are glad you are still with us on this program. This is Good Morning Kenya, coming to you live from KBC right here in Nairobi. And we'd love to know where you are watching us from this morning. So feel free to interact with us. You can check in via our various social media platforms. The hashtag that we are using on Twitter is hashtag Good Morning Kenya. Official station handle ever remains to be at KBC Channel 1 across Facebook, Twitter, and Instagram. So right now we want to move on to the next conversation. This is in line with election preparation, given we have about 8 days to go to the polls. But what are some of the aspects of our country's normal, quote-unquote, programming have been affected, and how have they been affected? Today, we will be narrowing in on the whole question around substance abuse, majorly focusing on drugs and alcohol. How has the progress that we have made so far as a country when it comes to containing this menace, and especially looking at the fact that the youth are at the center of this conversation, how has that progress been affected, positively or negatively? To help us with this conversation this morning in studio, we have with us Victor Okioma, who is the Chief Executive Officer at NACADA. Good morning and welcome to the program.
Thank you very much.
Thank you for making time to be with us.
Thank you very much.
Now, remember, you can send in your questions. You can also tag NACADA. Their Twitter social media handles are at NACADA Kenya across all the social media platforms. We will be going through your feedback as and when it comes in. Now, for the benefit of our viewers, let's start with NACADA itself as an institution, as an organization, as an authority. Give us the mandate and the functions of the authority.
Thank you very much for the opportunity to speak to Kenyans through this media. NACADA is a state corporation under the Ministry of Interior and Coordination of National Government. And it is mandated to coordinate a multi-sectoral response to the challenge of drug abuse in this country. That is very broad. In specific terms, we carry out public education programs. We work with other agencies in that space to respond to the challenges of drugs in the country. We also formulate policies around the issues of drug abuse in the country and advise the government on really what needs to be done to address the problem of drug abuse in the country.
Yes.
NACADA also, inspects and accredits rehabilitation facilities so that we are able to advise Kenyans on facilities that they can go to and get value for money. We have a big challenge around rehabilitation that do not meet the basic standards.
Yeah.
And sometimes people go there and they don't benefit. So in our inspection, we look at various aspects in terms of the skill mix, in terms of the facilities that exist in this institution. And of course, we also look at the serenity of an environment where these facilities are located. Finally, we also do a lot of work around enforcement, compliance. Compliance on a number of issues. Compliance on, for example, when the Alcoholic Drinks Control Act sets times when you should close and open, it sets, we work with other agencies. For example, there's a Kenya Bureau of Standards to, watch for the quality of alcohol in the market.
Yes.
And therefore, some of the compliance checks that we carry out, we do it at some agencies with these other agencies that can tell us, no, this is not certified, it doesn't have the quality marks, and we therefore will assess these products and remove them from the market. We work with the Counterfeit Authority. So in a nutshell, we really had tried to address the problem of drug abuse in the country by ensuring that we work with other agencies and address various offenses around various legislations by various agencies in government.
Right.
Yes.
Now, looking at the years that NACADA has been in operation, what has been the general trajectory of our country in line with dealing with drugs and alcohol and other substance abuse, aiming to make progress, generally speaking?
Let me say that this country has a very serious drug problem, and from where I sit, it's a growing problem, right, among the general population, with very high preferences of abuse.
Yes.
For example, if I can tell you, a lot of the mental-related issues around drug abuse. Yeah, alcohol leads in that area. In fact, is responsible for the biggest number of mental illnesses, followed by tobacco, all the way to the narcotics, the cannabis, for example, which is a very problematic drug in the country because of the severe, the mental challenges that it comes with. When you also look at some of the surveys we have done in our institutions, the problem has actually penetrated in our institutions. We have done a survey in primary schools, which clearly indicates that the drug problems are actually a serious concern in our institution, right? With very high preferences. The biggest challenge we have actually around it is the prescription drugs, for example, are most abused, right?
They're easily accessible over the counter.
Very easily accessible. When you release your young, students or pupils to schools, they pass through a pharmacy and pick some substances that ordinarily will pass for some drug to address some kind of illness. And these are substances of abuse. And we have a big problem around the prescription drugs. They are heavily abused in our institutions. Cannabis is also there. So in general, I would say that from the surveys we have carried out, this country is facing a serious problem of drug abuse, both in the general population and in our institutions. In fact, we are planning to carry out a survey in our universities. It's already ongoing, so that we can see. We have been tracking this from the primary school, secondary, and we'll be looking at the universities. And I can tell you it's a serious problem. So what are we doing as NACADA? Based on these surveys, we do a lot of programs, right? And one of the focus area for us is basically trying to share this information with Kenyans so that they can know what we are dealing with.
Yes.
So through our public education and advocacy programs, we sensitize the general population. We share with them these figures. We engage with the schools. Right, we have programs within our institutions. We call it the school program. The school program is basically targeting, sensitizing the students, training some of the teachers there to, on issues of drug abuse and prevention, so that they can be our contact people within those institutions. How much have we done? And compared to the problem, I can tell you it's a big challenge. There's a huge ground to cover.
Yeah. Now, let's come back to some of the most abused drugs in the Kenyan space, looking at our Kenyan context rather. We have alcohol, cigarettes, and bang being at the forefront. And these three are mostly abused by the younger population that are between the ages of 15 to 24 and can actually be extended further to the age of 10 years to 24. They are at the center of this menace. From where you stand, what are some of the causative agents that you have found that are leading this particular group to be the ones that are heavily abusing these drugs? And maybe we can start with the whole question of access.
Access is actually our biggest concern, because this I think maybe as a country we have become a drinking nation, and therefore it's available everywhere.
Yes.
Right? If you go to our homes, you find it in our homes. In fact, when we do the surveys on primary schools who are, who have been initiated into this, the message is that I learned this from my parents. I was initiated by my parents. When you go out during this, the Sunday or Saturday family outings, you are taking your tasker and the child is playing around and will have a test. Sometime at home they will access these things. So the issue of accessibility is huge. And I think, in my view, it has become like fashionable to be on some kind of a drug. Yeah, peer influence.
Before we get to continue with those aspects that contribute to this particular group being the biggest affected when it comes to substance abuse, we want to take a very quick break. We'll be back to continue with this discussion, but do stay with us. We're still using the hashtag Good Morning Kenya on Twitter. We'll be right back. Welcome back. Thank you for keeping us company this far. We want to move on with the conversation in studio this morning, all about substance abuse amid election preparations as we gear up for the general elections which are coming up in less than 8 days. How far are we, and what more needs to be done to just ensure that the drug and alcohol abuse, among many other substances, is under control? And with us in studio this morning, we still have Victor Okioma, who is the CEO at NACADA. Now, before the break, we were looking at some of these aspects that are contributing to the youth, and especially those aged between 10 and 24 being at the center of this menace. And we touched on access, and that has been tied to parenting. What more do you have to say in regards to that?
Yes, as I was saying, access is a big challenge to us. And by the way, there's a commercial element to it.
Yes.
Yeah, because the tobacco making industries want to make money. Of course, those who are the narcotic people. Like now, we have a problem of cannabis from Ethiopia, which is becoming a very popular stuff in the country, and young people find it the most interesting, and they will go out for it, right? Those ones who are selling the heroin and what have you, they have to get a market. In fact, sometimes they start by giving free,
to sample,
so that you get hooked, and then they have their market. So those are the commercial. That's the commercial interest that has made this the accessibility a big challenge. Even the mama, they call them Pima, Mama Pima. They want to make money also in their own small space. So they will be making this to raise some money to pay fees and do other things. So the issue of accessibility is a big problem. Despite the many crackdowns that you see chiefs and national government administrators conducting themselves, trying to address the issue of accessibility, we still have that challenge.
So now also tying into the aspect of parenting, which you had touched on a bit earlier on, looking at how parents are also making some of these drugs and other substances readily available for the youth to start even exploring, and even kids as young as 10 are now getting into alcohol and other drugs.
Parenting is a problem, and if you look at the survey we did on primary and secondary school, particularly the one on primary school, we have actually come out very clearly that parent are a risk factor by mere fact that they are the ones who initiate these people. You initiate by drinking in their presence. You initiate by taking them out as they are having their chips. You're also having the drink, and they test. In fact, we have cases where parents actually
willingly offer.
Yeah, give alcohol to their very young ones. And I wish they would know what damage they are causing to those young brains with alcohol. That notwithstanding, we have a big problem around parenting. We have a big problem around controls within our pharmacies, because some of the prescription drugs that are being abused, they are supposed to be given under prescription from a medical practitioner. But how the young people go to the pharmacies and access them is a headache that we have to deal with.
Regulation.
Yeah. Also, the regulations are also weak. And, some of the, like the trafficking networks for this, cannabis and heroin and what have you, those are underground kind of businesses. It becomes very difficult to even get to know how they are operating. But occasionally we are able to, get them, and you have seen a number of successful operations with very big sessions of some of those things, including one whole ship that the president blew up sometime, you remember? So accessibility is a big problem.
Now let's look at this particular group, and especially the young people, and now focusing on those that are in secondary and university. Let's start off with those in secondary schools, because they're also among those that are being initiated into drug and other substance abuse. What are some of the efforts that you are working with, and especially with secondary schools, to ensure that much as they are young but they are also exposed, you're also trying to help them not get to a point where addiction is a problem?
We have a number of programs that we are undertaking in those institutions. One, we of course create awareness by engaging these young people. We go to institutions and talk to them. Another program, we have had training for some, particularly the counseling teachers. You know, the counseling is focused on which combination of subjects you need to go and be a journalist. You know, that kind of counseling. But we are using them to kind of, we are training them to have skills around addiction counseling, so that they are able to detect and take action against drug problems within the institutions. Another milestone, I would say, is we have now worked with the Ministry of Education and come up with what we call guidelines for management of drug issues within the institutions, so basically the basic learning institutions. And these guidelines is kind of like a handbook that will enable a teacher to be able to detect and respond to the challenge of drug and substance abuse. We are also running what we call a life skill program, targeting those in Standard 5. And Standard 5, I think 7. And this is a special group, because this is the stage where they start getting...
The 10-year-olds.
Yeah, they start getting initiated. And the target or the objective of this program is to ensure that at that age, they are introduced into, you know, the knowledge about these drugs that are available, that are abused, and what they look like. They're able to see them and say, when you see this white stuff, suspect it could be this, okay? When you see this kind of, this could be some cannabis. So they are able to get the skill to identify those drugs and say no. That's really the objective of that program. And of course, we have also developed some materials for which are age specific.
Yes.
Yeah. These ones you can access them from our website. If you are a parent and you have a 3, 4, 5-year-old, there's some specific tailored messaging that we are doing to them. So these are some of the things we are trying to do to respond to the challenge of drugs, particularly among the young people.
Now, that also brings me to the slightly older category now, those that are in universities and colleges, because again, they have more freedom, they are a bit more independent, and they could be having access to some finances. How does NACADA step in to ensure that they're also not being misguided or misled in one way or the other?
That is an area where we still have a lot of work to do. But currently, you see, we have a program we call the Workplace Program, ADA program. And in the universities, which are public institutions or public sector institutions, have a performance indicator on drug abuse. And they are supposed to carry out some specific activities. I must say that universities are carrying out this program, the workplace program, but it's not so much targeting the student. It's actually more about the staff within the university. And therefore, what we are trying to do is to engage the universities to try and, you know, like now, I have talked about the survey we are planning to carry out with the universities. In fact, some have already carried out the data collection. and we have a few more that are carrying out, and we want to see how the situation looks like in the universities, because we are clear about how it looks in the primary, secondary. And when we get this information, our plan is to design specific interventions to respond to this information that is going to be coming our way very soon from this survey.
All right.
Yeah, but I must say it's an area that we need to do something about. From the interaction we have had with the universities as we were preparing to carry out this survey, they can openly say that they are seeing a problem.
It's a big problem.
It's a big problem there.
All right.
How big is it? How widespread it is, we'll find out when we have this information from the ongoing survey.
All right. Now, let's come to this space that we are in as a country. You know, every 5 years we get to go through the general elections. And for that particular year that we get to have elections, so many aspects of our country's stabilities are put to the test. Looking at the progress that we have made so far, as NACADA, in line with controlling drug and alcohol, among other substances, has that been affected by the fact that this is an election year, and even just narrowing down to this time that we are in?
Actually, as NACADA, we are running a program now that we started about 2 weeks ago. And this program we are calling Sauti Yetu. The program seeks to bring out the voice of the young leaders in our society. We are targeting the youth leaders. And why we are doing this is because, as a Kenyan, you know that during elections, we normally would have electoral-related violence, disruptions,
instability in a lot of areas.
And at the center of all this is drugs. Politicians give the young people drugs to go and stop their opponents from addressing meetings. They are even mobilizing them to go out there and ensure that certain processes do not happen.
They're disrupted.
Some of them, we are told, they are being used to go and buy identity from the areas where they believe is. So there are so many criminal activities that happen around this time. And at the center is the drug. So the purpose for this was to really engage the young people out there. And because they are youth leaders, they are in charge of certain groups, either chair of a boda or a chair of a youth group or a chair of whatever a church, association. And we wanted to hear their voice. And really what we were asking them is, what is responsible for all these things that happen around the election time? What, in your view, is the cause of this? And they have given us very interesting stories. They say we are incited by our politicians. Yeah, we are given drugs by our politicians. They are the ones saying it. Therefore, the question we are asking them now, how as a leader, can you help in preaching peace to those that you lead, so that we have a quiet country as we go into elections? I must say that during elections, we have a lot of drug-related, conflicts and violence and clashes and disruptions of other meetings of other people. And the purpose for this Sauti Yetu is to just hear the voice of the young leaders on how they intend to help us. I mean, what they can do to contribute to peace during this time round. That's really the essence.
And maybe somebody could be watching us and wondering, okay, fine, we know drugs and alcohol are a big problem, but in line with the general elections, and we are knowing this is an electioneering period, so why is it important to have this conversation around the role that drugs and alcohol and other substances, they play in regard when it comes to peace before, during, and even post the elections?
In fact, if you are a Kenyan, I think it is something that should naturally come out clear to you, that you young people are used by politicians to cause problems. They are given drugs, they are given alcohol, they are given money to disrupt other people's meetings. In fact, like now, I'm being told that the others are being told you must, when you vote, you must sit there and make sure that you defend, you protect the votes. The question one will ask, you have gone into a polling station and cast your vote, and you walk out of the compound. How do you protect the vote which is fenced off and there is security out there? But this milling around the polling stations, and the fact that they have been given some 100 shillings and they have been bought some drugs, this is what actually causes a lot of the conflict that you see and the fights that you see. And what we are telling them is, you vote. There is no chance that you can protect that vote. That vote is protected by the IBC and the security people, and it will be counted before they leave that polling station. So you have no job milling outside here trying to pretend you are protecting the vote by being so many meters away from where the vote is. If it's going to be stolen, it will be stolen in there, not out here. And therefore, we really want to speak to the youth of this country. You know, especially the age you are talking about. That is the age that is the most active, very energetic, and unless their energy is directed positively, they are the cause of problems whenever we have elections.
Now, would you say we have the political goodwill in this electioneering period, specifically considering, yes, we've had the support of the government over the past few years leading up to this electioneering year? Do we have the political goodwill, and especially from those that are aspirants for various elective positions?
If you ask me, I would like to see the political leaders, particularly those who have offered for themselves for the position of president, because of the kind of crowd they are pulling. If they can really, you know, encourage their followers to maintain peace during this election. I've seen a few of them speak on to this issue of conducting peaceful elections and not being violent, and let us be peaceful. We want to see more of it.
Okay.
But we have also seen some pronouncements that are very disturbing, especially for us in NACADA. Yeah, when a presidential candidate makes pronouncements to the effect that is going to legalize cannabis, and when you see the kind of excitement of his followers about that issue of legalizing cannabis, then I say we are going the wrong direction. Cannabis is the most problematic drug we have as a country. It is responsible. In fact, they go to the rehabs and they ask them what has brought them to those rehabs. Some of the kind of psychotic cases that we have, they have a lot to do with cannabis. And the misinformation that is coming out of this general pronouncement is that, you know, other countries have legalized. When you go to those countries that have legalized, you find that actually you cannot do trafficking in those countries that are said to have legalized. They have only legalized production under very strict controls for pharmaceutical purpose. Not for smoking, not for
recreational purposes.
Yeah, so this information should come out. Even those countries, they are saying in the US, they have legalized for recreation. Ask the kind of controls they are put in place. You cannot access more than so much. Yeah. So it is not a free-for-all kind of thing. And the message that, you know, the misinformation that is getting out there is making these young people know that, think that this has been legalized and we now are free to smoke. I've even seen cases where they are taking, you know, they are being photographed trying to, you know, smoke this thing. And we want to say that, and I've been very clear about this, that you know, the Anti-Narcotics and the Psychotropic Substance Act is still operational.
In place, yeah.
Right? So if you are excited and you go against the law will catch up with you. And we don't want to go there. Just know that the law is there, and only Kenyans have the power to change the law. Parliament can only change, enact a law that has been subjected public participation, which is the requirement of the Constitution. And then Kenyans will have said, yes, legalize, or no, you don't legalize. You may want to legalize, but the Kenyans will say no. Through their public participation forums, they have a responsibility as a Kenyan to say yes to whichever law or policy through public participation. So let's wait and see whether the Kenyans will say, let's go that direction.
So looking at, and especially now that you've mentioned, the presidential candidates, because they do command the biggest masses when it comes to this electioneering period. What would be your sort of clarion call to the presidential candidates in line with helping the youth not be misguided and misled when it comes to drugs and alcohol, substance abuse, because they are making pledges and promises once they assume office, I will do this and this and this.
We want them to be at the forefront of calling on the youth to be agents of peace as we go into elections, and to avoid being, using drugs to cause, violence and conflicts and disruptions of other people's, political activities. Let them allow those who want to say whatever they want to say it. Let them know that you have a choice. You will make it at the ballot. You will not physically, stop somebody from exercising is a constitutional right to vote. And therefore, according to me, and I have seen it in the rallies, we want to encourage those leaders to embrace peace and talk to their young people to maintain peace. And I want to say that drugs, some of the money that is given in these functions, they go into drugs. Let them encourage those ones to go wanunue unga. Ama kazi nyingine ya maana.
Yes.
Yeah.
Now, let's also look at the aspect of NACADA being at the center of this fight against substance abuse, but you cannot work alone. You need an enabling environment and other agencies to come on board to help make your efforts more effective. What are some of these approaches or other partnerships that you feel are relevant towards the fight against substance abuse?
By the way, NACADA works through partnerships. Even I think we have a memorandum of understanding with KBC on which clearly identify areas where we need to work together. We have a message, but you are the people to deliver it for us, to Kenyans, through your programs. We work with a number of partners, right? Even when you look at the board itself of NACADA, it has the church is represented. We have an organization dealing with the youth, like the Girl Guide Association is a member of the board. We have very many ministries, Ministry of Health, the Ministry of Education, because of the drug issues in institutions. And out here, we work with the church organizations. We work with the women group. We work with the border, associations. The drug issue cannot be left to an agency of government.
Yes.
The drug problem requires the participation of everyone. And therefore, we deliberately go out of our way to engage partnerships and to work with others. Like when you talk about compliance, NACADA cannot tell you that this thing is the quality is not, that doesn't have the right quality. That's why we work with the Kenya Bureau of Standards. They will say this thing has not passed the test, and we don't even know where it came from. And we have a lot of this kind of drinks in the market which have not been certified with Kenya Bureau of Standards, and which therefore could be poisonous. We don't know what it is.
Yes.
That's why we find, the principle of working as one by government agencies. That's why we work together. We work with Counterfeit Authority. We work with Kenya Revenue Authority. And we work with the Kenya Revenue Authority to tell us this thing has actually paid taxes. And therefore, we know it came through the normal channels. That's how you distinguish it from contraband, things that come from nowhere, nobody knows where.
Okay.
So for us as NACADA, partnership is our way of doing business. And we cannot afford to work without engaging in partnerships, both in the media, and we actually... Like we have a working arrangement with the Media Council. We have even trained some journalists on issues of drugs, so that when they are reporting on drugs, they have some kind of information.
Yes.
And we even promise to, give an award to the journalists who will give us some kind of good investigative journalism into some of these intricacies around drug trafficking. All right. So partnership is our way. That's how we work.
All right. And still speaking of partnerships, there at the end of this particular chain, when it comes to drugs and substance abuse, we have rehabilitation and the centers in our country. First of all, do we have enough rehabilitation centers in Nairobi and the larger spaces of our country?
The answer is straightforward, no. We don't have enough rehabs. And when I say enough rehabs, I mean the ones that meet the minimum best standards.
Yes.
Right?
To accommodate the numbers as well.
We have a number of rehabs that we have inspected and closed because they couldn't meet the standards. They don't have the right staff. They don't have the serene environment where they can operate a rehab. Some of them have even they don't have the right equipment that you require to do the rehabilitation. When somebody is going into a rehabilitation for us is a process that starts with screening when you get to the rehab. Once you have screened, you are identified whether you have a medical issue that needs to be addressed. You need to go to a medical clinic and have your medical issues addressed. You go to a rehabilitation, you go through all those group therapies, or individual counseling sessions and all that lasts 3-4 months. And we also want that once you have got to stabilize, you need to be given something like a skill, something that a livelihood kind of skill that can help you when you come out. That's what we try to emphasize as NACADA. So that somebody who has been wanaitwa maunga huko, it's like they don't belong to anybody. Their family has abandoned them. So when he comes here and he goes through this process, at the end of it, he needs to come out there with something that he can go to live on. And this is what we encourage rehabilitation to do, so that there is a life skill at the end of it. You said they are not enough, and I have said the challenge is investing in rehabs, publicly owned rehabs will be the solution. The private facilities, in fact, like the one I think we have licensed this financial year would be, I think, about 120. 95% of them are privately owned, commercial, and therefore expensive and inaccessible.
Comes in the whole aspect of
inaccessible. Our appeal is to the county government who are doing the mandate of health is now
devolved.
Licensing of private bars and restaurants is also devolved. Formerly, when we used to license ourselves as NACADA, we would make money and give out to counties to do, some programs, ADA programs, including rehabs. We have supported actually a number of counties to do some rehabs, about 10 or so. And our appeal is to the county governments to invest more in rehabilitation facilities which are publicly owned and which will be more affordable to as many Kenyans as possible. That is our appeal. Otherwise, the way the situation is, we do not have enough rehabilitation facilities. As NACADA, we have, as a way of showing the way, and following the directive by His Excellency the President, we have started a rehab in Miritini in Mombasa. The purpose for that is basically a training ground, and for purpose of benchmarking, we want to do a model rehab for this country. And it's a big dream that we want to realize over time. We currently, I think, are having about 250 people who come in outpatients every morning. They get their methadone and get a bit of psychosocial support, and then we disengage. But we have inpatients, I think about 35, 37 there, and we are increasing that number very soon to, I think, about 70 inpatient. when this Meritin Rehabilitation Center is finally up and running, we expect that it will be having an inpatient of about 200 or so. Yeah, with the training wings and with some workshops where we can train people on various livelihood skills and things like that. Because that is what we want to promote, a rehabilitation process that ends up with a livelihood skill
to make them self-sufficient.
Yes, so that one of the reasons why these people find themselves in that situation is because of idleness. They don't have anything. They don't even have a skill. So if you are going to address this problem, you must also provide a skill. Even just knowing how to rear chicken, you can make money out of it.
Yes.
Yeah.
Okay.
Those are the kind of things we are thinking about. Yeah.
All right.
You can do furniture and you go out there and start making your own furniture. Those are the things we are encouraging.
All right.
Yes.
Now, as we draw closer to the end of this conversation, I have Wasonga on Twitter who is asking, in line with the efforts that you are doing to ensure we're bringing down the numbers when it comes to substance abuse, are street children being considered?
You see, anybody who has a drug problem must be considered.
Yes.
The issue, the problem is, we work with some, civil society organizations like who are within the community to help us identify those who are supposed to go for rehabilitation in our facility. I have said as government, we have not really invested much on that, on rehabilitation, and that's why we are appealing to county governments to do more of these facilities. And when they do these facilities, like the 10 counties that now have facilities that they can, admit people and treat them.
Yes.
They should know that they should not discriminate against anybody who has a problem. So if you are in the streets, if you are in a home, if you are in a school and you have a problem, you should be able to access treatment and rehabilitation.
Okay.
Yeah.
Now, there's also one tweet from Lewel Njo who's asking, when it comes to some of these resources about information on rehab, where they are in terms of location, how can they be found? Do you have these resources on your website maybe, or as NACADA?
All the facilities we inspect and accredit, you will find them in our website. In fact, what we tell Kenyans is that to be sure that you are going to some facility where you can get the help, you go to our website, look for a facility around where you are. If it's accredited by us, we have our checklist of various things that we look into. If it's not in our website, then really you are risking by taking your patient to that kind of facility.
All right.
Yeah.
Now, finally, as we close, this conversation has been anchored mainly in line with the electioneering period that we are in, and also looking at substance abuse. What would be your message to our viewers this morning as they prepare for, the home stretch of this campaigning period, and also just looking at the fact that after elections is also a very sensitive period? There's your camera. Just your message to our viewers this morning.
Well, all I want to tell Kenyans is that election will come and go. Kenya will remain. Especially the young people who are our focus. Let them not allow themselves to be used by 50 shillings, 100 shillings to undermine the democratic processes of campaigns and voting. Let them not be used. If you are given 100 shillings to go and disrupt a meeting, go and buy skuma wiki, go and help your family have a meal. So our simple message is, let us avoid being used this time round, and let us ensure that we carry out a very peaceful electoral process and continue with our life after this. Sometimes we behave like the world is ending on 9th. 9th is going to be a normal day. You go just vote and go do your border business, do your other businesses, and life continues after 9th.
Life goes on. Yeah,
life goes on. Let's not behave like the election on 9th is going to be the end of the country. The country is still going to go on.
Life goes on after the 9th.
Yes.
All right. Now, that brings us to a close of this conversation. We have been speaking speaking with Victor Okioma, who is the Chief Executive Officer at NACADA, all about election preparation as we gear up with about 8 days to go for us to get into the voting day. Thank you so much for making time to be with us. We do appreciate it.
Thank you very much for the opportunity to speak to Kenyans.
All right. Now, my name is Jain Wambui. Thank you for your time. Be sure to join us again tomorrow morning. For now, bye-bye. Enjoy the rest of your viewing.